In this video, I would like to teach a strategy called action first, situation next. So what does this mean? In the OSCE, where time is a very big factor, what you need to do is first read what is expected from you. Don't start reading the whole scenario. Instead, look for what they're asking in the task. If the task says take history or explain the diagnosis or talk to the patient and explain the differential, then you can go back to the scenario and read what is in there. Because now you know what the action is, now you go into the situation and read the scenario in a way that is helpful for what is asked in the scenario. Many students start reading the whole story, and by the time they come to the test, they forget what is in the story. So the best thing to do is ask what is needed in the scenario, read the tasks first, and then go back and read the situation. This is a classical thing I have. In my clinical exam, when I was taking the exam, I had a very lengthy stem. But when I read the task, all it says is, you have found out that this patient has liver cancer. Explain the diagnosis to the patient and the daughter and answer daughter questions. So technically, by reading the task, I didn't have to worry about what is in the scenario because I clearly know it is a counseling station. Just by reading the task, I understood what the scenario is, and now I have to turn towards the patient, explain what liver cancer is, and answer the patient questions. So this is why you save so much time in the OSCE or clinical exam by reading the task first and then looking to the situation or the scenario. If you would like to know more about my OSCE Mastery Coaching System and the 5 pillars to pass the clinical exams and be successful clinician, look for a link under this video or in the bio, and I will see you inside that video program.